Dr. Collins, it's a nightmare for everybody involved, from the students to the teachers to the unions to the state and local and federal politicians trying to make sense of what to do here. What would your recommendation be, at a broad level for everybody involved?
Absolutely. This is really one of the most consequential decisions of our times, and you have to think of it in the context of schools being such an important source of not only learning, but also for safety and security during the school day, for children of essential employees, food security for millions of children across the U.S. who don't have adequate access to food, and healthcare services for kids who get that through the school. So with schools being in sort of this limbo state of should they open, should they close, everybody's in a bind right now. And as you said, everybody, whether it's a parent or a teacher or a school district leader or a union leader, everybody's really struggling with what is the safe thing to do. And I think what's paramount to keep at the center of this is we need to do what's safest for our children, and we need to make decisions informed by the science, with a recognition that things are changing and evolving, and our knowledge of COVID transmission and how to keep kids safe will continue to change. And so we're going to need to modify protocols as we go.
So there are 55 million students, K through 12, across the United States. That is a lot of millions of students. We're anticipating that the president is going to announce that the federal government will begin distributing millions of rapid coronavirus tests to states this week, specifically for this age group of children. Are these tests quick enough? Are they trustworthy enough, Dr. Collins? And is it possible to administer them effectively enough to get kids healthy and back into school as they are?
So there are a number of metrics to consider about reopening schools. Right now, I think it's 9 of our 10 largest school districts in the country are completely virtual, with New York being the first to start some in-person instruction for its lowest grades. And Los Angeles Unified, of course, trying to do school-based testing for its kids so that they can resume in-classroom instruction. In addition to low rates of community transmission and ensuring that you have adequate personal protective equipment and other risk mitigation measures at school to make schools safe to reopen, you also need to have access to testing. And you need to have access to testing that is reliable and has a quick turnaround time. So right now we have some kids waiting for tests for over a week. And the problem is, if you have a kid we're suspicious of COVID and then you pull them out of the classroom, as well as anybody who was exposed to them, you could shut down classes of schools for 7 to 14 days. So I think, getting rapid tests that are evidence-based to be effective will be really important to helping us get schools open.
Briefly, Dr. Collins, we're almost out of time, but with your background as a bioethicist, who should be making these decisions? Should it be school unions? Should it be principals of individual schools? Should it be the federal government?
It's got to be a collective effort with weigh-in from public health leaders as well as infectious disease specialists and educators, together trying to figure out what's safe and best for our students.